Hi, my name is Dr. Shahin Javaheri. I'm a plastic surgeon practicing in San Francisco, California. I am double boarded by the American Board of Plastic Surgery and American Board of Otolaryngology. My specialty is plastic surgery, but my specific specialty also is implants of the body, various areas of the body, including the skull, the areas of the face, like the mid-face, the jawline, the chin, the cheekbones, pectoral areas, biceps areas, triceps, deltoids, thigh implants, hip implants, buttock implants, calf implants, and even some other areas of implants that are not very common. I wanted to discuss first by starting to discuss about the skull area. The skull area generally done for people who desire changes in the skull. Either they have congenital disorders or born with a narrow size of their heads. Sometimes people refer to them as pinheads growing up, unfortunately. And also, if they desire to have some change in their skull, for example, I have a plastic model of a patient who had a deformity in the front area, the frontal skull. This area was very narrow and under projected. And we created an implant based on 3D CAT scan technology, and an implant was created using that. And this implant was made for the patient that was exactly to fill the area that was desired. This implant was placed through a very small incision in the top of the scalp, and placed through that incision right over the bone, and with some very tiny screws was kept in place. This is one example. Another example is a patient who actually had more of a deficit involving the facial bones, the top part of the facial bones around the eye, and also a forehead. An implant created that looked something along like this. And this was, again, made through a fairly small incision on the top of the scalp. And the implant was slid underneath and secured using little tiny screws. And then again, we had patients who had the back end of their skull that was completely flat, and an implant was created just for that particular purpose and placed through, again, fairly small incision on the top of the scalp and placed behind the scalp and kept in place with screws. I've also done patients who've had very large deficits in their scalp, and sometimes the implants that are created, they're so large they need to be cut in two pieces. This is an example of a patient who had an implant that was extended all the way to the almost the entire forehead and the entire back of the scalp. Again, this was secured using screws that I mentioned already, and through fairly small incision in the scalp. And I've even had implants that were even larger. These are examples of skull implants. And this creates a normal looking skull according to the patient and what we consider normal. Another areas that I've done implants on is the cheek, so-called cheek implants. Cheek implants are something that are like this. Now, these are standard implants. They can also be customized to fit the particular design the patient wants. For example, if you want to have a patient become more masculine looking, we can create an implant to create a more masculine looking implant, or even feminine looking implant. But generally, the implants are designed like this. They're inserted through a very small incision inside the mouth, so there's no external scars, and the implant goes right over the cheekbone. And sometimes, again, they can be customized to create larger implants. This is a standard cheek implant that goes right over the cheekbone and creates a more projection. Sometimes a patient has a deficit that's under the cheek in the mid-face. We can place an implant that's called a submalar implant, and it goes something along like this. Again, through a very small incision inside the mouth, the implant is introduced into that pocket that's created, and a very small screw, just like the cheek implants, is placed to create a nice shape and also to prevent the implant from moving. There are various other implants that can be placed under the upper lip or under the nose that can bring the mid-face forward. Customized implants that can be created using 3D technology and CAT scan. Another very common implant that is placed is a chin implant. And chin implant is something that goes through usually very small incision under the mouth. It could also be inserted inside the mouth. But generally, a chin implant is, again, they come in different shapes and sizes. They can also be customized too. An implant is placed just over the chin, like this, through, again, a very small incision. My incisions generally are no more than half an inch or 1 centimeter. And again, the implant is placed right along the chin. Sometimes they can be placed with two little screws or just with sutures. And this is an example of a chin implant. Sometimes the patient desires more mandible widening and the angle of the mandible. They come in different shapes and sizes. An implant that can be placed through the incision inside the mouth, so there's no external incisions, although sometimes it can be placed from outside the jawline too, in special circumstances. But nevertheless, the implant is placed through a small incision inside the mouth and secured using screws, and this creates a more widening of the jawline, like this. An implant is the screws are placed so that the implant does not move and creates a very nice shape to the jawline. Patients frequently have hollowing of the temple areas. This is some areas that I specialize in. This particular implant is an extended implant, and it goes right along behind the side of the eye and the temple area to remove that hollowness that is created with age or other factors. And the implant is placed, it does not move, it goes right under the fascia of the temporalis muscle, and there's no implant show. An implant looks, the area looks very natural after the placement. These can also be made to be much larger, to include even the whole side of the patient's face or skull, if patients had a very narrow looking side of their skull. And the implant can be placed to encompass almost the entirety or even the entirety of the side of the skull. These are temple implants. They can be, again, as mentioned, of various sizes. Going back to the midface, patients sometimes have hollowness in the lower eyes. Fillers can help that area, but the problem with fillers, whether you put them in the cheek, chin, or anywhere, is first they absorb quickly. Sometimes they can result in unevenness, and very rarely they can get into the bloodstream and cause anything from blindness to tissue necrosis. A tear trough implant is something that goes a small incision under the eyelash and is secured in this area. It's a one-time operation. Never have to place filler again. That goes with the cheekbone, chin implant, or tear trough implants. Is much superior to any fillers you can ever place. One-time operation and no more. So I want to talk now about body implants. The main difference between body implants and cranial or facial implants is that the implants in the face, whether they are the chin or the midface or the skull, they're placed over hard tissue. In other words, they're placed to go right over the bone. The difference in the body implants is they're essentially soft tissue augmentation or muscle augmentation. For example, the deltoid. The deltoid is an area where generally we have three muscles, and the muscle looks kind of triangular. So the implant can be created, and generally I create a custom implant in the deltoid area. But they can also use regular implants. But these implants are created to simulate the shape of the deltoid. The incision that I use is a small incision above in the shoulder area. There are other approaches to this. I find this to be the best approach. And the implant is placed right under the fascia of the muscles of the deltoid area. There are three particular muscles in the area. The triceps muscle and the biceps muscles are areas that that are augmented with implants. These implants, again, are soft tissue implants. They're meant to simulate the particular muscle that a person has. So it's a muscle augmentation procedure. A biceps and a triceps implant generally look something along these lines. This is actually a calf implant. There are really no such thing as biceps implants, but there is such a thing as a calf implant. But we use something along that are similar shaped. Again, they come in different sizes and even slightly different shapes. But the operation involves a very small incision in the axilla, the armpit area. The incision is well hidden. That incision is usually no more than an inch or so in length. And the implant is placed right over the muscle, under the fascia. Sometimes an implant can be placed through a small incision in the middle of the arm that goes under the muscle itself. And the triceps is basically the same to simulate the triceps muscle. In here, the biceps goes in this area. They come in different sizes, and we can put large implants depending on the patient's desires and so on. Another area that we augment is in the pectoral areas. Is very common areas that we implant. Pectoral muscle implants can be done for people who have had, for example, congenital disorders, traumatic disorders, or just for aesthetic reasons. The implants they come in different shapes and sizes. This is an example of one particular one. This is more on the smaller side or medium size. This implant is placed through, again, no more than an inch incision, about 2.5, maybe 3 centimeters, through a small incision inside the axilla, the armpit. It's not uncommon for people to have multiple implants at the same time, especially when it comes to upper body, like the pectoral implants, biceps, and triceps. The one small incision can be used to place the biceps and the pectoral implants at the same time and through the same incision, whereas the triceps incision is done through a smaller incision behind. But this is an example of a pectoral implant. This can be done like this. It's a submuscular implant placed under the muscle of the chest, the pectoral muscle. They can be at that size. It can be even very large like this, or they can even be custom to be created to be even larger than than this particular type. This implant goes like this. Again, it can be shaped other ways too. It can be placed like this, depending on the shape that a patient desires. And the implant is important to be placed to highlight either the middle of the chest, bottom of the chest, or the sides, depending on what the patient wants. Implants can also be placed on the thighs. These generally are done custom implants or other implants that can be modified to create the anterior part of the thigh.